Ohio Congressman Bill Johnson, who serves on the House Energy Subcommittee on Oversight and Investigations and was at today's hearing until he stepped out to be with us. Congressman, what do you believe about the travel ban? You asked some questions. Other members of Congress did. Did you get the right answers that you were looking for?
No, I did not, Gretchen. I'm very concerned. We still don't know what we don't know. We don't know how the two healthcare workers in Dallas contracted the virus. And because we don't know that, it's very, very clear that there are some gaps in the plan. And that's what concerns me most. Dr. Frieden acknowledged there are 150 people per day coming to America from West Africa. And for us to believe that with the gaps in the plan that we've already identified, that they can track those 150 people for 21 days and catch them during their exposure time and during their contagious period time as they travel all over the United States is just mind-boggling to me. I think a travel ban has to be on the table, and I think it would be irresponsible not to consider it. Other African nations have already implemented a travel ban from the countries there in their own region.
Yeah, it's interesting when you ask the American people what they think about this. I want to highlight this poll, a recent poll by Fox News. So, should U.S. ban flights from countries where Ebola virus has broken out? 60% of Americans say we should. It's interesting, though, Congressman, because I believe that the CDC has said as the reason that they're not in favor of it is because it would stop business, it would hurt the economies of those nations, and it would also not help in eradicating the disease in those countries. And now I'm hearing that you would have to get everyone on board universally to agree to this sort of travel ban. Your thoughts?
Well, this cannot be about international diplomacy, and we cannot be concerned about the economic well-being of other countries when the public health and public safety of our own citizens is at risk. We must make prudent decisions that are going to protect Americans, and for us to allow 150 West Africans per day to come into our country and seemingly get by the screening process, because if they don't show any symptoms, nobody ever knows that they're sick until they get into that contagious period within that 21 days.
Right.
There are just too many things, Gretchen, that we do not know, and until we know what we don't know, we need to go with caution and make sure that we protect the American people.
All right, what are you hearing from your constituents? Because you represent the state of Ohio, where in fact this plane took off from to go back to Dallas with the second infected nurse. What are you hearing from them?
Oh, very concerned. I applaud what Governor Kasich has done in Ohio to address this situation and to get out in front of it. But I asked Dr. Frieden just a little bit ago, how do we stop one of these 150 that are coming in per day from going into any rural hospital in Appalachia, Ohio, and getting sick in the emergency room and throwing up and then exposing the virus to not only the people in the emergency room but to the healthcare workers that are going to be working with them? He did not have a good answer for that. And he gave me no certainty that the plan has been thoroughly tested out across the nation, maybe in isolated circumstances, but not on a broad scale.
Well, I think that that's quite apparent today by the fact that those two nurses have been moved to the biocontainment units, one in Maryland at NIH and one at Emory in Atlanta. I mean, was that not an admission that quite possibly hospitals across the country, especially in suburban areas and rural areas, are not equipped to handle Ebola?
Well, it certainly should send up a red flag, Gretchen, because in Dallas, at the hospital where the original patient was and these two healthcare workers worked, they had all of the information. They were following the CDC protocol, and it still failed. What's going to happen when West Africans that have been exposed to the virus start tramping all over America and in those rural areas or those suburban areas? What's going to happen in those hospitals?
It's a good question, and as you're saying, you didn't get all the answers that you wanted today with at least this hearing. Congressman Bill Johnson of Ohio, thank you for your time.